Hello, my friends, my family. How's everybody doing today? Much love to everyone. As you know, COVID-19 outbreak, now a pandemic. World Health Organization declares. Let's see what we got here. Expressing alarm both about mountain infections and slow government responses. The World Health Organization declared Wednesday that the global coronavirus crisis is now a pandemic, but also said it's not too late for countries to act. By reversing course and using the charged word pandemic that it had previously shied away from, the UN Health Agency appeared to want to shock lethargic countries into pulling out all the stops. We have called every day for countries to take urgent and aggressive action. We have rung the alarm bell loud and clear. All countries can still change the course of this pandemic if countries detect, test, treat, isolate, trace, and mobilize their people in response, he said. We are deeply concerned by alarming levels of spread of severity and by the alarming levels of inaction. I'll play a video in a minute about what is a pandemic. The WHO added that Iran and Italy are new front lines of the battle against the virus started in China. They're suffering, but I guarantee you other countries will be in that situation soon. Italy weighed imposing even tighter restrictions on daily life and announced billions of financial relief Wednesday to cushion economic shocks from the coronavirus. Its latest efforts to adjust to the fast evolving health crisis that silenced the usually hustling heart of the Catholic faith, St. Peter's Square. In Iran, by far the hardest hit country in the Middle East, the senior vice president and two other cabinet ministers were reported to have been diagnosed with this COVID-19, the illness caused by the virus. Iran reported another jump in deaths by 62 to 354, behind only China and Italy. In Italy, Premier Giuseppe Conte said he would consider requests from Lombardy, Italy's hardest hit region, to toughen the already extraordinary antivirus lockdown that was extended nationwide Tuesday. Lombardy wants to shut down non-essential businesses and reduce public transportation. These additional measures would be on top of travel and social restrictions that imposed an eerie hush on cities and towns across the country from Tuesday. Police enforced rules that customers stay 1 meter, 3 feet apart, and ensured that businesses closed by 6 p.m. Milan shopkeeper Claudia Sabanti said she favored stricter measures rather than run a risk of customers possibly infecting each other in her children's clothing store. She decided to close it. Well, anyways, we know things are going to start closing down. We're going to be seeing a lot of different things happening within probably the next several days. But here's a little short video from the Euronews Coronavirus. What is a pandemic?
Well, we've heard the word pandemic being coined around the novel coronavirus before, with the likes of the German Health Minister Jens Spahn using it earlier on Wednesday. But the announcement from the WHO is certainly significant. They had previously been calling the novel coronavirus the spread of a very high risk. That's the highest level that they had before officially making the declaration of a pandemic. Now, they say this was because, as you heard in that shot there, they were severely concerned by both the alarming levels of spread and severity and the inaction from relevant governments. Now, the announcement has certainly got a lot of people talking on social media. The word pandemia is currently top trending on Twitter. And if we look at Google Trends, the word pandemic, very little interest over the last week until it reached a huge spike today with that WHO announcement. A lot of people taking to search engines to ask, What exactly does this mean, and what is the context? Well, let me try and answer a few questions about exactly what this means with regard to the novel coronavirus. It started out as a small outbreak. That's when then there's a small but unusual number of similar cases of one virus, particularly in this case in Wuhan, Hubei province. That then grew to an epidemic, from an outbreak to an epidemic when it got over a larger geographical area and other people started to get affected. But when does this epidemic become a pandemic? Well, the definition that a lot of people refer to is from the Dictionary of Epidemiology, and they say that a pandemic is one of an epidemic which occurs worldwide over a larger area, crossing international boundaries, and usually affecting a larger number of people. Now, as we heard, the World Health Organization have been very careful to say that it is not a word that they use carelessly. And what it actually means is that really it doesn't change the assessment of the threat posed by this novel coronavirus. And it certainly doesn't change what they are doing and advising governments to do when it comes to this. Now, for context, the last WHO pandemic declaration was made in 2009 over the H1N1 influenza outbreak, more commonly known as swine flu. There were other coronaviruses such as SARS in 2002-3. That wasn't declared a pandemic because it was largely contained within both China and Hong Kong. But a clear message here, Ollie, with this declaration that while it doesn't necessarily change much in terms of their response, they say that this means that they are trying to call for more urgent action, perhaps from both governments and authorities, to help with this virus outbreak. Well, we've heard the word pandemic being coined around the novel coronavirus before with the
Okay. Now we have from the WHO, World Health Organization, questions and answers. I'll be leaving the links in the descriptions below, but I did open this one. Is there a vaccine, drug, or treatment for COVID-19? Let's see. It says, not yet. To date, there is no vaccine, no specific antiviral medicine to prevent or treat COVID-2019. However, those affected should receive care to relieve symptoms. People with serious illness should be hospitalized. Most patients recover thanks to supportive care. Possible vaccines and some specific drug treatments are under investigation. They are being tested through clinical trials. WHO is coordinating efforts to develop vaccines and medicines to prevent and treat COVID-19. The most effective ways to protect yourself and others against COVID-19 are to frequently clean your hands, cover your cough, and bend of your elbow or tissue, and maintain a distance of at least 1 meter, 3 feet from people who are coughing or sneezing. Crazy, huh? Well, I'll be going live tonight. We'll be talking more about it. I hope everyone's doing well. Stay safe. Much love to everyone. I'll be seeing you later, okay? Take care, everyone.